been a practicing physical therapist for 34 years, and this is the most significant change that I've made in my private practice in the last 24 years. My name is John Hisamoto. I'm with Proactive Physical Therapy in Tampa, Florida. It's a single practice sports medicine orthopedic practice that we've had for about 25 years now, and we've been lucky enough to be very successful and not have a significant downturn like a lot of my friends have. Well, I know that right now we're probably selling close to $5,000 of product a month, and that translates over to a $5,000 profit typically for me per month. So I know I'm adding a $40,000 to $50,000 a year benefit that I wasn't having before. And it's a benefit that we all understood we needed, but I didn't put the entire package together. I understand that change is part of what we have to face. One of the things I'm concerned about is that we're not getting all the pieces of the puzzle that we need sometimes in the small private practice. And so 6 years ago in Seattle, Washington, at the private practice section, I heard how important it was to create a cash-based solution to some of the problems. And while I agreed with that, the biggest issue is that no one told us what to do or how to do things. The first part is that none of my therapists wanted to sell. They were like, the perception of selling is wrong. But at the same time, when someone's asking you for something, it was pretty easy. So the first introduction was BioFreeze. All I said to my clinicians was, at your initial evaluation, make sure you take a couple of samples of BioFreeze home with them. Okay? You don't have to do anything after that. Just make sure they get it and offer it to them. And what happened is people came back and we sold out of our first little kiosk of BioFreeze in the first week. So we knew that there was something about that. It wasn't us telling them, it's that they simply sampled it and they utilized it. So after that, we started to look at our home exercise programs a little bit more effectively, utilizing TheraBand, utilizing flex bars, all the different components that we needed to be able to complete a really good home exercise program. And what we found is that people valued what we were teaching them. They valued the concept of being able to go home and initiate this exercise program today. And by the time they came back to see us, they had already been through the exercises 5 to 7 times. They weren't out looking for it. They weren't out buying it someplace that might be $2 cheaper, but an hour later. So they realized that the value was actually there with what we were providing for them.